Okay, welcome back to the channel. It's Dr. Pace, Change-of-Pace Chiropractic. We got a new patient on the table. I'm excited because she found me on social media and she had some things going on. I know it causes a lot of dizziness for her. And so she was inquiring about, if adjustments would help her. The official diagnosis is persistent postural-perceptual dizziness. And it feels like sometimes she has detachment, feels like for her, as far as floating when she's walking or moving. Her system gets overloaded easily. Certain lights also affect her as well. The adjustments kind of help with the nervous system because we are taking pressure off of the nerves. But the spine itself, protects your whole spinal cord and essentially the central nervous system. She has some hip issues as well. You probably see she has a little rotation in her hips. She kind of mentioned that as well. So we're going to be, obviously doing our typical adjustments to rebalance the body. But our focus more so is, kind of assisting with some of her symptoms of feeling like she can't really get her grounding, so to speak. This table's about to lift up underneath you here. I'm gonna leave that up for a little minute while we adjust the ribs here. Okay. Warm up my hands a little bit. And again, we're starting off the ribs first. Okay. So constant reminder about the rib cage. The reason why I adjust this, that rib cage is going to be moving up and down with your lung expansion and contraction. Okay. So there's restriction along the rib heads here that obviously can affect your breathing. It can also hold tension in the mid back, create mid back issues as far as pain, tension, or discomfort. Okay. So on these adjustments, we already experienced one impulse there, Theresa. That's typically what you're going to feel the rest of the way. These are very subtle. You're not going to hear the loud cavitations that pops from the rib heads. You can feel them sometimes unlock though. Okay. All right. So that was your lower one. We're going to continue on up into that right shoulder. There you go. Very good. So far, so good. As far as pressure, good. Nothing is stuck yet. Everything feels pretty good so far. It's a good idea just to check it, make sure. So we're going to zero in on this lower left SI joint to counteract the rotation over here to the right. Okay. You're going to feel a couple of impulses right where my thumbs are, right around that joint I kind of pointed out to you in that exam. Okay. And that table's going to drop underneath you about 2 or 3 times. Okay. Here's our first one. Make sure you're okay with this impulse. Good. Very fast. Are you okay there? Okay. Going back to that joint there. That SI joint right here. Right back. Good. You're going to feel that one more time. I'm going to get a little rotation in this one next time. There you go. Thank you. All right. How we feeling so far there? Okay. Let's go back to remeasure and see where your tailbone is sitting. Again, we can kind of see this by, there's equal distance in her leg movement. So this one's stopping a little bit shorter, getting a little bit of resistance in her leg movement over there on the right. That means her tailbone is probably sitting to the left a little bit more. So I'm going to cross that right foot over the left one. Leave me cross there. We're going to be zeroing in on this part next, okay? Good, nice rotation right there. That lower part of your neck, we're going to kind of get right into. You may hear a lot of noise on this one, okay? All right, very fast. Get it out the way. Oops, big release there. You okay? Uh-huh. Been years since we've been adjusted. That was a lot in that first. Are we feeling all right now? Okay, good. Very good. Left shoulder, continue to relax. There we go. That was huge as well. Yeah, man. Working with your hands. Yeah, this area here gets very tight. Okay. All right, right here. Give me a big breath in here. And release for me again, Theresa. That's perfect. And quick. There you go. All right. Okay, now I got to loosen up this lumbar spine. I'm going to get it right around that SI joint for you, too. I'm going to feel a slight roll. This will be a fast impulse into that lower back as well. Good. There you go. Not bad. Not bad. How you doing? Good. Straighten this leg for me. Hang that off to the side. We're going to go into a stretch for your sciatic nerve and your hips here. I'm going to stabilize your shoulder. Feel a nice big stretch here. Give me a big breath here. Breathe it out for me. Good. All right. Same thing. Not going to let you fall. Again, just kind of relax your legs mainly for me. That was huge. Needed that too, man. Okay. Let's stretch this one. Pull it up for me. There you go. Now, I need you to give yourself this big hug. Okay. You're going to protect your chest this way. All right. Now we're gonna lay on top of my hand to get this mid back area opened up for you. Okay. Keep your chin tucked to your chest for me the entire time. Now I'm gonna guide you back. I'm gonna rest your weight into my arm here. Okay. But just keep your chin tucked. Okay. All right. The rest of here. Good. Give me your weight. There you go. Let it rest. There you go. All right. Go ahead and lay right on top of my hand. Keep your chin to your chest for me though. And feel a quick impulse right here. That's what I'm talking about. Yes, man. All right. You ready? So we're gonna go into the top of the spine. I'm gonna put my thumb right here. Okay. So that's literally all I'm using is my thumb. And just gonna feel a quick little push here. And you may not hear any noise on this. We may have already got it. Okay. Ah, it was already moving. That's it. Okay. No need to get nervous. This isn't a Y-axis adjustment yet. But we're about to get to that. Okay. All right. Same thing. It's gonna be my thumb right here. Quick little push here. Good. We are all moving there. Okay. So this next part, again, is a big adjustment. Okay. So it involves the entire spine, but it's over with in less than a second, as always. Okay. My hand is going to be underneath your neck. So our target is on to the tilt. And so again, we're going to decompress everything. All right. Taking pressure off of your disc. This may create some space for you to a little easier down into your shoulders and hands as well. Okay. Oh, huge release. Okay, my friend, we are done with the spine. You made it through the neck adjustment. She was nervous about that, by the way. Now I'm going to go into the rest of your body, okay? So ankles, knees, and hips up next. A nice big stretch here, this foot. Let this relax for me. I'm going to feel a quick stretch. All right, I know you needed that one. Okay. We got to check out this ankle and foot. Again, she wore some kind of shoes or something that was tight. And hasn't been right ever since. Okay, so my wife kind of had something like this happen too. Let's take a look at this knee. All right, not bad. That was a fibula hip adjustment. Then we're going to take a look at this hip here. Again, same effect. Big pull right here. Okay, let this relax. Good. Nice release of hips. Both of them. Check out these wrists. Okay. All right. Let your hands relax for me as much as you can. There you go. All right. Yeah. These usually get crunchy. All right. Let's check out this elbow. This one feels a little weird. It's a little quick stretch. In the business of helping her. Okay? It's a quick stretch. Just like, all right? Everybody always gets nervous with the elbow, man. Elbows and necks. There you go. So that's what I'm looking for, that little release there, okay?